Early on in my career, I was taught any patient that leaves the office with a prescription for an opioid should also leave with instructions for how to take stool softeners and laxatives. That was more than 25 years ago. The most common stool softener at the time was docusate sodium, and the most common laxative we used was a Senna product. 25 years later, I still tell each and every patient to use a docusate product and a Senna product, just so you know. A stool softener and a laxative combined with their opioid, because most patients who take an opioid will develop constipation to the point where they're going to need treatment. So we prophylax their treatment. I think many clinicians are probably not as aggressive as I am in preventing opioid-induced constipation. So if someone comes to the pharmacy to fill their opioid prescription, the pharmacist should just reflexly say, "What are you taking for stool softener and laxative?" And the patient will say, "Well, nobody told me to take anything," or, "My doctor told me to take stool softener and laxative, and here's my plan. And I have some instructions for dietary modification, I have some instruction for bowel hygiene, which is appropriate, I have some instructions for a rescue program in case I don't move my bowels for a couple of days." So I think the pharmacist can play a role to make sure that there's at least a regimen in place for patients to address the constipation that comes from opioids.